The goal of this video lecture is to review the different classes of psychoactive substances and discuss examples of these substances and their psychoactive effects. So a substance is any natural or synthetic product that has psychoactive effects. So these are products that may change behavior, they may change thoughts, they might change emotions, or they might change perceptual experiences. And we have a range of different classes of psychoactive substances that are categorized both on the basis of their mechanism of action, so what they are doing in the brain to produce these psychoactive effects, and also their characteristic effects on an individual. So we have a number of classes of psychoactive substances that are relevant to thinking about our DSM-5 substance-related disorders. Our first class of psychoactive substances are the depressants, and these are drugs that work by reducing central nervous system activation. So depressant drugs include alcohol. They also include a set of drugs that the DSM classifies as sedatives, hypnotics, and anxiolytics. So this includes classes of medication such as benzodiazepines and barbiturates. So examples of benzodiazepines would be drugs like Xanax and Valium. An example of a barbiturate would be a drug like Seconal. So the physiological effects of the depressants are related to the reduction in central nervous system activation. You can see involuntary movements of the eyes, tend to see a high level of sedation or sleepiness. At higher levels of depressant use, this can also be associated with risk of coma or risk of death, typically through respiratory or cardiac suppression as a result of that central nervous system depression. In terms of behavioral consequences of depressant use, they can involve slowed speech, a loss of coordination or unsteady gait, and also disinhibited behavior. So for example, sometimes inappropriate sexual behavior or inappropriately aggressive behavior due to this disinhibition. Psychologically, many of the depressants have an initial euphoric emotional response, which is then typically followed by a more depressive emotional response. But it's not atypical to see that biphasic response where you've got an initial improvement in mood and some euphoric mood followed by later depressed mood. Emotional symptoms can also include relaxation and a reduction in anxiety. And also you tend to see some cognitive impairments. So for example, impairments in attention, impairments in memory, and also impaired judgment and impaired decision making. Our next class of psychoactive substances are stimulants. So stimulants work by increasing central nervous system activation. There's a number of classes of drugs that are classified as stimulants. So these include cocaine, and cocaine can be administered in different forms. So there is cocaine that can be snorted intranasally. There's crack cocaine, which can be smoked. There are amphetamines, so this includes drugs like methamphetamine. It also includes stimulant prescription medications such as Ritalin or Adderall that are often used in the treatment of ADHD. And nicotine and caffeine are also classified as stimulants. So these are some of the most widely used psychoactive substances in the United States. So all of these drugs work by increasing central nervous system activation. So the physiological effects of the drugs are related to the central nervous system activation. You can see dilated pupils, you typically see a rapid heartbeat, you can see alterations in blood pressure, so you may see increased blood pressure, you might also see blood pressure dysregulation or a decrease in blood pressure. You can see alterations in muscle functioning, so you might see muscle weakness or also twitching muscles. You can see changes in temperature perception, so you might see perspiration or sweating. You might have chills or hot flashes. One characteristic physiological symptom, particularly that we see with cocaine and amphetamine use, is that you'll see decreased appetite or weight loss, particularly with more long-term use of stimulants, that you may have weight loss related to this decreased appetite and decreased eating behavior. Other GI symptoms include nausea and vomiting. You can also see seizures related to stimulant use. In terms of behavioral consequences, it's very frequent to see increased sociability and also just an increased overall activity level. You can also see restlessness or a high level of nervous energy, rapid speech or rambling or tangential speech, and psychomotor agitation. Psychologically, the typical emotional response is euphoria or a sense of excitement. There can also be hypervigilance and anxiety or some paranoia, anger and irritability, impaired judgment and confusion, and some cognitive impairment. Our next class of psychoactive substances are the opioids. So these are substances that work by binding to opiate receptors in the brain. Natural opioids tend to be derived from the opium poppy. We also have synthetic opioids that work by the same mechanism. So these include drugs like heroin and morphine, synthetic opioids like fentanyl, and also prescription pain medications like oxycodone or hydrocodone. So if we're thinking about brand names for these medications, these would be drugs like Percocet or OxyContin. So the physiological effects of opioids, one effect is that they have profound pain relief properties. They also will result in constricted pupils, drowsiness or sedation, a sense of lethargy. And again, at higher levels, you can see coma and death, similar to what we saw with the depressants, typically through cardiac or respiratory suppression. In terms of behavioral consequences, you can see slurred speech and apathy, so a general decrease in behavior and a loss of behavior. Psychologically, we're seeing similar to what we saw with the depressants, an initial sense of euphoria, often followed by some pronounced dysphoric mood, some low mood. We also see some substantive cognitive impairments, so we'll see impairments in attention, impairments in memory, and impairments in judgment. Our next class of psychoactive substances are our hallucinogens. So their defining characteristic is that they are producing perceptual illusions and distortions. So these are drugs that are leading to altered perception of reality. An individual may be experiencing hallucinations. They may also experience some delusional thoughts. So these include drugs like LSD and peyote. In the DSM-5, we also include phencyclidine in this category. This is also called PCP or angel dust. Technically, this drug is not classified as a hallucinogen, but the effects of PCP are similar to the hallucinogens, so the DSM-5 groups them together. So the physiological consequences of hallucinogen ingestion include dilated pupils, blurred vision, rapid heartbeat, sweating, heart palpitations, tremors or seizures. At high levels, it can be a coma. Behavioral symptoms include a loss of coordination. You can also get belligerent and impulsive behavior, particularly with PCP. Frequently you'll see physically aggressive behavior and psychomotor agitation. So characteristically, both physiologically and behaviorally, we're seeing increased activation. Psychologically, there can be a range of emotional consequences, including anxiety and depression, paranoia, including delusional beliefs, perceptual changes, including a range of hallucinations. So visual hallucinations are common, auditory hallucinations, tactile hallucinations, all kinds of different unusual sensory experiences, and also impaired judgment and poor decision making. Our next class of psychoactive substances is cannabis. So cannabis and various cannabinoids work by binding to cannabinoid receptors in the brain. So typically these are drugs that are derived from the cannabis or the hemp plant. We also have synthetic cannabinoids. So the most common cannabinoid is marijuana. So this can either be ingested through smoking. It can also be ingested in edible form. Also, sometimes there are different cannabinoids that are put in oils that are placed directly on the skin that have different psychoactive effects. So the physiological effects of cannabinoid use include red eyes, increased appetite, dry mouth, and a rapid heartbeat. Behaviorally, the most characteristic symptom is impaired motor performance, particularly slowed reaction time. Psychologically, we tend to see feelings of relaxation and also sometimes euphoria. More negative psychological experiences include anxiety and paranoia. We also typically see some cognitive impairment, including deficits in memory, deficits in attention, impaired concentration, and impaired judgment. And sometimes, particularly at high levels, some individuals will experience perceptual distortions. So they may have alterations in perception, or they may have some hallucinatory experiences. And then finally, we have our inhalants. So these are volatile substances that produce chemical vapors. And when the chemical vapors are inhaled, it results in central nervous system depression. So this includes substances like solvents, like gasoline, glue, and paint thinners. It also includes anesthetic gases, so things like nitrous oxide. And sometimes the use of inhalants is referred to as huffing. So what that refers to is the process of deliberately sniffing these volatile vapors in order to produce these psychoactive effects. So the physiological effects of inhalant use include symptoms like blurred or double vision, lethargy or stupor, muscle weakness or tremor, or coma. Long-term consequences of chronic inhalant use can include respiratory damage, so damage to the lungs, permanent brain lesions and brain damage, dementia, and long-term liver disease and kidney disease, and inhalant use can also result in death. So one common cause of death related to inhalant use is sudden cardiac arrhythmia that occurs when an individual is using these inhalants. Behavioral symptoms can include apathy and a loss of behavior. You can also see belligerence and assaultiveness, similar to what you would see with something like PCP. You can see slurred speech or a loss of coordination or unsteady gait, slowed behavior and psychomotor retardation. Psychologically, some of the substances will produce an initial sense of euphoria, particularly in the immediate few seconds after the inhalant has been sniffed, and also impaired judgment and cognitive deficits. So thinking about these classes of psychoactive substances, there are 10 classes of substances in the DSM-5 that have separate diagnostic criteria for the various substance-related disorders. So the DSM provides separate sets of diagnostic criteria for alcohol-related disorders, caffeine-related disorders, cannabis-related disorders, hallucinogen-related disorders, so this includes phencyclidine and other hallucinogens. The DSM separates these out. Diagnostic criteria for inhalants, opioid-related disorders. It groups the sedatives, hypnotics, and anxiolytics together. We have two sets of diagnostic criteria for the stimulants. We have cocaine and amphetamine and other stimulants classified separately, tobacco-related disorders, and then we also have disorders either for other substances of abuse, so substances that cannot be classified in any of the above categories, or we also have diagnostic criteria where a person is clearly under the effects of a psychoactive substance, but the exact nature of the substance that they have ingested is unknown.